So, good afternoon, everyone. I would like to welcome you all to another live session from Let's Update Language Academy for OET reading module. Let's just wait for a few minutes for more people to join in and then we'll begin shortly. Okay, so I can see people joining in. So, yes, good afternoon, Priya Amu, and good afternoon, Anjana MA. And hello, Amal Raj Binoy, and good afternoon, Ashwati Krishna Prasad. And hi, Amal Kumar. So, now we are going to begin today's reading module discussion. So before that, I would like to give you an introduction about the OET reading subtest. That is, I just want to give you some guidelines and relevant information for those of you who are trying or attempting for the very first time. Okay, so that is the OET reading subtest basically consists of three parts. Okay, it's subdivided into three parts, which is part A, part B, and part C. And you will have a total of 42 questions, okay, of which 20 questions will be from part A, 6 questions from part B, and 16 questions from part C. And regarding the time duration, you will have a total of 60 minutes or 1 hour to solve the entire subtest, reading subtest, and of which part A will be allotted 15 minutes, and part B and C together will be allotted 45 minutes. Okay, and so today we shall be discussing the part B module of the reading subtest. And what is part B? What is it about, and what basically it assesses your ability to identify the purpose or main idea from a short text quickly. Okay, so that is what part B is about. It basically assesses your ability or evaluates your ability to identify purpose or main idea from a short text very quickly. Okay, because you are not supposed to take more than 2 minutes to solve an answer for part B and part C, so you have to do it very quickly. And okay, what does it consist of? Okay, what is the nature of information that will be included in part B? So this is a nature of kind of nature of information or extracts that you can expect in part B. That is emails, memos, guidelines, policy documents, circulars, notifications, announcements, manuals, or internal communication. These kind of information is something that you can expect from part B module. Okay, and okay, so part B basically consists of 6 short text. Okay, that means extracts. Okay, and it will be followed by 6 questions. Okay, so each question will be of 3 option multiple choice in nature. Okay, and so how do you go about cracking part B? How do you approach part B? So basically, you can, the first thing that you need to do is you have to read the heading to understand what the text is about. Okay, that is really very important because you need to know, okay, what is this extract about? What information am I going to read? And then read the question to know what information you need to find. Okay, so first read the question to identify that, and then read the content of the text, which is extra. Read that, and the aim of reading that should be to find the answer to the question you have just read. Okay, so even though you are reading it, just make sure you are also trying to find the information about the question you have read before. Okay, and then read the answer options and decide and choose most appropriate answer. Okay, so that is what you need to do. Okay, when you are going to approach part. Okay, so and then there are some guidelines I need to tell you. That is, you should be able to choose the answer easily if it is directly and specifically mentioned in the text. Okay, so that means the answer would be directly mentioned or highlighted in the text. Okay, so that's a direct answer. Okay, so you need not brainstorm much. Okay, that is an easy option, and you will directly get your answer. Okay, but What if it's not directly mentioned? Okay, it's indirectly mentioned and you are unable to find a direct answer, then you can choose the elimination method. In elimination method, what you need to do is you will get enough information or enough evidence to prove the other options wrong or incorrect. Okay, so if that is done, if you don't get a direct answer, then you can choose this method wherein you can get enough evidence to prove the other options wrong, and then you can reach this answer. Okay, so and then you can see whether, okay, if is this suggested or hinted, is the correct answer suggested or hinted from the text. Okay, so that method is also possible. Okay. So you can choose whichever is convenient for you, depends on the extract whether it's directly mentioned or not directly mentioned. Okay. So yes, now we shall begin the reading discussion of a part B module today. So I hope you can see this on your screen. So this is the part B module of a reading subtest, and I hope you can see this extract text 1. You can see the heading, the extract, and the question, and 3 options. Okay, so now we shall go about solving this. So first, what you need to do, as I told you, you can read the heading, that is developing diagnostic tests for respiratory disease using sound measurement and machine learning techniques, clinical trial. Okay, that is what the heading is about, and then comes the extract and the question. Okay, the clinical trial is, that is a question. So now you can take a minute to read this extract, and then you can explore the options and decide and choose the most appropriate answer. And let me know your answers through the comment section in Facebook. For those of you who have joined in late, we are currently having the reading module discussion of part B, and I've given you a minute to go through the extract and come up with your answers. Okay, so you are not able to see option C. I'll just scroll up a little bit. Okay, so I can see more of you putting in your comments here. So yes, good afternoon, Chinju Prasad, and yes, good afternoon, Shirley S. Shirley, and yes, good afternoon, BG Ajo, and hello, Anne Matthew, and Jinsi. Yes, good afternoon, Jinsi Alex Benny. So you can all put in your answers, your choice of answers in the comment section in Facebook. I'll read out your answers and then we'll discuss. So yes, good afternoon, Ginny, Saljo, and good afternoon, Taran and Jenish. You can all put in your choice of answers in the comment section. And yes, I can see answers coming up. So BG Ajo has put in B, Dilshad Dils has put in B, Asha Jobi has put in B, Chinju Prasad has put in B. Okay. And Devika Devu has put in option B as answer. Amal Kumar has put in B as answer. Julian Manish has put in B. Jinsi Alex Benny has also opted B. So I think it's a unanimous answer. All of you are going with B. So yes, so the correct answer is indeed B. That is exploring new ways to confirm a person has a respiratory disorder. Okay, so we shall just read this extract and I'll just highlight the information which will lead you to this answer. That is, this study is designed to develop accurate digital diagnostic test used on a smart device for common respiratory illnesses in children and adults, including asthma, bronchiolitis and COPD and pneumonia. These tests can be used in resource poor communities, emergency departments, or via telehealth applications. The aim is to develop tests that are as accurate as an expert clinical assessment but do not need a clinical examination or other investigations such as x-rays to be performed. Patients with a history of a chronic respiratory condition or who have symptoms of an acute respiratory disease are not included. Patients will be excluded if they have an inability to provide a cough either spontaneously or voluntarily, are unable to provide informed consent or assent, have severe respiratory distress including the use of CPAP or BiPAP, or have had abdominal or eye surgery within 3 months. Okay, so now and coming to the question, the clinical trial is exploring option A, open to people with severe respiratory symptoms, B, exploring new ways to confirm a person has a respiratory disorder, C, aimed at checking that expert clinical assessment. Right. These are three options, and the correct answer, as you all opted, the correct answer is indeed B. And And the reason for the answer being B is that, see, basically here they have introduced us to this digital diagnostics. That is, this study is designed to develop. Okay, so they are developing accurate digital diagnostic test here. Okay, so basically they are developing. Okay, so they are introducing us to an idea of developing or coming up with a new diagnostic test, basically, right? And that is, what is that for? That is used on a smart device for common respiratory illnesses in children and adults. Okay, so that is why they are introducing or developing this digital diagnostic test, and that is for this respiratory illness for children and adults. Okay, so that is why your option is, correct answer is option B. And I'll just highlight this information which will lead you to this answer. Okay, and if you are exploring option A and C, and if you can definitely prove that's wrong also, that is, option A is open to people with severe respiratory symptoms. Okay, they have not informed us so that this is only meant for severe respiratory symptoms. Okay, so we cannot take that for an answer. And option C is aimed at checking that expert clinical assessments are accurate. Okay, so they are, this is not aimed at checking whether it's accurate or not accurate. Okay, they are definitely telling that, okay, they are introducing this diagnostic test for respiratory illness, and it seems to be accurate. Okay, it should be accurate, definitely, but the main aim is not to check whether it's not accurate or accurate. Okay, the main idea is they are introducing these or developing these kind of tests, and this is aimed at aimed at, what do you say, confirming or assessing whether a person has a respiratory disorder or respiratory illness. Okay, that is what the main aim. Okay, so that is why we have B. Okay, and now we shall proceed to the next question. That is text 2, and the heading is Pregnancy Care Guideline 2018 involving an interpreter. Okay, and this is the extract, and this is the question, and the three options that follow. So now I'll just give you a minute to read the extract and come up with your choice of answers. Okay, so I can see most of you coming up with answers. So I'll just read the extract now. Okay, meanwhile, you can put in your answers here. So, okay, Pregnancy Care Guideline 2018 involving an interpreter. So it is a responsibility of the health professional to make sure that the communication is clear. Accredited health interpreters assist by translating the discussion between the health professional and the woman, communicating with the woman in her preferred language either in person or through a telephonic service. Involving an accredited interpreter, preferably with training in medical terminology, is recommended for all antenatal appointments. If the health professional and the woman have difficulty, interpreters accredited by National Association of Accreditation for Translators and Interpreters have been assessed as having a high level of technical competence in both English and one or more other languages and are bound by a code of ethics including strict confidentiality. However, there is a shortage of accredited interpreters, particularly for languages of new and emerging communities. While involvement of female interpreters is preferable in antenatal care, their availability may also be limited. Okay, so that was what the extract was about, and the question is the guideline highlights. Option A, the need for accredited interpreters at all appointments if there is a language barrier. B, that an accredited interpreter is recommended for all antenatal visits. C, that health professionals are responsible for translating discussions. Okay, so these are the three options, and I can see most of you coming in with your answers. So yeah, so BG Ajo has put in option A as answer. Chinju Prasad has responded with A. Dilshad Dils has responded with A. Jency Elizabeth Johnson has responded with A. Bindu Kurian, Asha Joby, Tarin Jenish, Dixon Jose, Binsi Manu, Grishma Bimal, Jinsi Alex Vicky all responded with option A as answer. Okay, so I guess I'll give you the answer. The correct answer is indeed option A. So good for all those who have answered A. So, and I'll tell you the reason why it's A. So basically, what is this guideline about? So it is telling you that it's a responsibility of the health professional to make sure that communication is clear. Okay, so the communication or the discussion that's happening, that should be clear and understandable, basically, right? So accredited health interpreters assist by translating the discussion between the health professional and the woman, communicating with the woman in her preferred language either in person or telephone service. Okay, basically, so healthcare interpreters are there, and they are assisting for the translation of the discussion between the healthcare professional and the people whoever is the patient, or whether the women, they have definitely referred to women. So basically there will be healthcare interpreters to do this. Okay, so for the communication, to make the communication clear and understandable, so involving an accredited interpreter, preferably with training in medical terminology, is recommended for all antenatal appointments if the healthcare professional and the women have difficulty. If they are facing a difficulty communicating or understanding, then uh, it should there should be an accredited interpreter who should be involved and taking care of this communication. They should be responsible and they should make sure that everything, every important information is conveyed. Okay, and there is no room for any confusions. Okay, so that is what is mentioned here. So involving an accredited interpreter, preferably with training in medical terminology, of course, is recommended for antenatal appointments if the healthcare professional and the women have difficulty communicating. Okay, and this is the sentence which will lead you to this answer. Okay, if there is a language barrier, definitely if there is any difficulty communicating. So yes, yes, I can see more of you coming up with answers. Yes, Anjana, MA, Libby, Joji, Jinsel, yes, they have all responded with A. Okay, so good. So now moving on to text 3. Okay, so that is patient safety advice, medication. That is the heading, and the question is the patient safety leaflet encourages patients to, and the extract is here, and I'll give you a minute to read the extract and come up with your choice of answers, and then we'll discuss it. Okay, so I can see answers coming up already. So now we shall read this extract. So it's important you keep track of your medicines. Taking the right medicine at the right time will help you get well. Using medicines in the wrong way may cause unwanted side effects. To be medicine wise in hospital, you need to tell staff you have had an allergic or bad reaction to any medications, or if you have trouble swallowing medicines. You should tell staff straight away if you feel unwell and after taking any medicine. Let staff know if you think you should have received some or the medicines appear different. It is important that all medicines are explained to you before you leave hospital to go home or to another care provider. Always ask your doctor, nurse, or pharmacist if you don't understand your medicines. Questions you should ask about your medicine in hospital are: what is this medicine for? Are there any possible side effects? And can they be taken safely with us? Okay, so that was what the extract is about. So now moving on to our question. The patient safety leaflet encourages patients to: option A, check the nurse understands the medicine guidelines. B, ask staff to clarify the directions to follow about taking their medications. And C, be sure the doctors ask questions about your medicine. So I can see most of you coming up with your answers. So Chinju Prasad has responded with B. Asha Jobi, Julian Manish, Dixon Jose, Jinsi Alex Benny, Binsi Manu, Anjana M.A., Jilna Shine, Bijay Aju have all responded with option B. Answer. So the answer is indeed option B. So good. All of you who have answered B. Yes, Jinsi Raj has also answered B. So, and let's see why it's B. So, Basically, the patient safety leaflet encourages patients to. Okay, so that is the question. Okay, so what have they mentioned? So basically, initially they have mentioned that it's important to keep track of your medicines and taking it at the right time. Okay, and they have informed you about taking in the wrong way may cause side effects. Okay, and yes, and you need to inform the staff that if you had an allergic or bad reaction to any medications, or if you have trouble swallowing medication, you need to inform them. Okay, and you should tell the staff straight away if you are feeling unwell after taking medications also. And let staff know if you think you should have received some medicines or the medicines appear different. Okay, and the next point is it is important that all medicines are explained to you before you leave hospital to go home or to another care program. Okay, so it's important that all medicines are explained to you. Okay, and always ask your doctor, nurse, or pharmacist if you don't understand your medicine instruction. Okay, so yes, it is also mentioned. Okay, so and that is why your answer is B. Okay, so basically they are telling you that you all these information about the medication, the dosage, and all those information should be explained to you. If not, you need to always ask them, doctor, nurse, or pharmacist, for the medicine or medication instructions. Okay, you need to follow them. Okay, so that is what is mentioned in option B. Ask staff to clarify directions to follow about taking their medication. Okay, and what about option A? Check the nurse understands the medicine guidelines. No, it's not anywhere mentioned that the nurse needs to understand the medicine guidelines. Okay, that is something already known to the doctor, the nurse, or the pharmacist. They may know this information, but that is not relevant or important. That's not anywhere mentioned here that the nurse needs to do this. And what about C? Be sure the doctors ask questions about your medicines. Okay, so definitely, you need not make sure that the doctors ask questions about your medicines. It's you who have to ask and clear these and get definite instructions based on your medication. Okay, how to have them and dosage and all that stuff. Okay, so you need to ask them and you need to get the information. Okay, so it's not about the nurse or the doctor, and it's not about them that they need to ask questions or understand the medicine guidelines. Okay, so that's why it's not A and C and it's B. So moving on to the next question, memo to staff, re-escalation process for dispute resolution. And there's a question that follows: if the inpatient team cannot agree on accepting a patient who has to attend a case conference. Okay, so I'll give you a minute to read the extract and then we'll. Okay, so now I can see you coming up with your answer. So now we shall just go through the information or the extract. That is, if on review the inpatient team disagrees that a patient requires admission to the respective specialty, inpatient team shall make the onward referral to the alternative specialty. The senior inpatient MO shall provide the alternate specialty with a clinical handover and advice of the time frame in which the patient must be reviewed. In the event of a dispute regarding inpatient team acceptance of the patient, a consultant level case conference shall be convened. The case conference shall include the ED, original inpatient, and alternative inpatient consultant. The three consultants shall make a timely clinical decision regarding the patient's admission. If the matter remains unresolved, then the case shall be escalated to the Executive Director of Medical Services EDMS for a clinical and time urgent decision. So that was what the extract was about. And the question is, if the inpatient team cannot agree on accepting a patient who has to attend a case conference, then the options are A, the senior MO from the alternative specialty, the ED consultant, and the original inpatient team representative. Okay. And who has to attend the case conference is what the question was. Okay. So A option has these many options, and B is the patient, the senior patient medical officer, and the executive director of medical services. Option C, the patient's first consultant, a consultant from the ED, and a consultant from the alternative specialty that the inpatient team suggests. Okay, so these are the three options. Okay, so I think some of you have responded. Yeah, Jixon Joes has responded with A. Jinsy Alex Penny has responded with B. And the rest of you, you can put in your choice of answers in the comment section in Facebook. Okay, so Chinju Prasad has opted C. Vijay Ajo has put in B. And what about the rest of you? You can put in your choice of answers in the comment section in Facebook. Okay, so the correct answer for this is option C. That is the patient's first consultant, a consultant from the ED, and a consultant from the alternative specialty that the inpatient team suggests. Okay, so where is this information mentioned? So what they have mentioned is, in the event of a dispute, look at the second paragraph regarding inpatient team acceptance of a patient, a consultant level case conference shall be convened. Okay, so that will be done, and the case conference shall include who will be included over there. That is the ED. Okay, so original inpatient and the alternative inpatient consult. Okay, so that is what is mentioned in C. Also, the patient's first consultant, that is the original inpatient consultant, as mentioned here. Then a consultant from the ED, that is also mentioned here, ED, and a consultant from the alternative specialty. That is what they have mentioned as the alternative inpatient consultant. Okay, so all three options are mentioned, all three categories of people who are included in the case conference. Okay, in the event of what do you say, a dispute regarding inpatient team acceptance of it. Okay, so these are the people who will be attending the case conference. Okay, so I hope there is no confusion over there. Okay, so now moving on to question number 5. Text 5. So the extract is about taking a blood pressure reading manually, and the question is, how is a preliminary palpatory systolic blood pressure check performed? And this is the extract, so I'll give you a minute to read the extract and then we'll proceed. Okay, so I can see most of you have started coming up with your answers. So now we shall read this together. So that is taking a blood pressure reading manually. So wrap the cuff around the patient's arm and use the index line to determine if the patient's arm circumference falls within the range area. Otherwise, choose the appropriate smaller or larger cuff. And palpate, locate the brachial artery and position the BP cuff so that the artery marker points to the brachial artery. Wrap the BP cuff snugly around the arm. Ensure the cuff is located about 2.5 centimeter above the antecubital fossa, crease of the arm. Perform a preliminary palpatory systolic blood pressure. To achieve this, palpate the arm and the antecubital fossa to locate the brachial artery with your non-dominant hand and ensure the pressure valve is closed. Inflate the bladder until no blood is flowing through the artery and no pulse is palpated. The pressure reading on the manometer at this stage is an estimate of the maximum pressure required to measure the systolic pressure. Deflate the cuff and rest the arm for 1 to 2 minutes. Allow the blood to be released and recirculate. Okay, so that was what the extract was about. And moving to the question, how is a preliminary palpatory systolic blood pressure check performed? And coming towards options, option A is feeling for a pulse in the crook of the elbow, inflating the spigomomanometer cuff until the pulse stops and noting the reading after a minute or two. Option B, feeling for a pulse in the crook of the elbow, inflating the spigomomanometer cuff until the pulse stops in the non-dominant hand. And option C, feeling for a pulse in the crook of the elbow, inflating the spigomomanometer cuff until the pulse stops and noting the reading. Okay, so what do you think the correct answer is? So I can see Julian Manish, Linta Biju, Punni Cyril and Jinsi Alex Benny responding with option C as the correct answer. And what about the rest of you? You can put in your choice of answers in the comment section Facebook. Okay, so okay, let's evaluate or assess the options. Okay, and you can, it's a little bit confusing for some of you because yeah, because of the information provided in all the three options. So you can try the elimination method or the direct answer method, whichever is convenient for you. Okay, if you do not find enough evidence to prove or come to the correct answer, then you can find enough evidence to prove each option wrong. Okay, and then come to the correct answer. Whichever is convenient for you, you can choose that method. Okay. And yes, BG Eju and Nimsha Prasad has also responded with C and A respectively. Okay, so now looking at the options, let's assess option A. Feeling for a pulse in the crook of the elbow. Okay, so that's correct. And inflating and cuff until the pulse stops. And noting the reading after a minute or two. Have they mentioned that you have to note the reading only after 1 or 2 minutes? No, that is not mentioned. Whatever they have mentioned about the 1 or 2 minutes is after deflating the cuff, rest the arm for 1 or 2 minutes to allow the blood to be released and recirculate. That is what is mentioned. I'll just highlight that in a different color to understand. Okay, so they have mentioned you need to rest your arm so that the blood will be released and recirculates. Okay, it's not about noting the reading. Okay, so that is why option A is incorrect. Okay, so evaluating option C, option B, feeling for a pulse in the crook of the elbow, inflating the cuff and until the pulse stops in the non-dominant hand. Okay, so they have not mentioned that you have to check for the pulse in the non-dominant hand. What they have mentioned here is to achieve this, palpate the arm to locate the brachial artery with your non-dominant hand. Okay, so they are asking you to palpate the arm and locate the artery with your non-dominant hand. It is not on your non-dominant. Okay, so yeah, so that is what they have mentioned. Okay, both mean different things entirely. Okay, so that is why option B is incorrect. So it's not, they have not mentioned it's done on your non-dominant hand, it's done with your non-dominant hand. Okay, that is what is done, not about the reading or measuring the pulse. They are asking you to locate the artery with your non-dominant hand. Okay, that is what is mentioned. So we have got enough evidence to prove option A and B is incorrect. So moving towards C, feeling for a pulse in the crook of the elbow, yes, that's there. Inflating the cuff, yeah, that's there until the pulse stops and noting. That is mentioned. Definitely, you can get that kind of information. That is suggested from the extract. Okay, Is why your correct answer is option C. Okay, so that is definitely implied from this paragraph. Okay, okay, so moving on. I hope this is clear to you. So now moving on to the next question, the last question, part B. GP notify guidance for GPs, and the question is when GPs patients are entered into the GP notify system, the GP. Okay, so what does he have to do? So I'll give you a minute to read the extract and then we'll discuss the answer. Okay, so now let's read the extract. GP notifies an automated notification system that informs GPs about patient admission, patient discharge, patient death. When a patient is admitted, discharged, or dies, the automated computer system will inform the patient's nominated GP by email or fax of the update. GPs will receive an enrollment confirmation the first time such an event occurs. The form needs to be completed and faxed for automated notifications to continue. To receive notification via fax or email, you will receive an enrollment confirmation from form the first time an event occurs on one of your patients. Once the form is completed and returned via fax, automated notifications will commence. If your contact details change, notify the GP notify coordinator. Please note that the GPs are responsible for ensuring the details are correct and ensuring fax machines or computer systems provide adequate privacy after transmission. So the question is when a GP's patients are entered in the GP notify system, the GP, and the options are A, needs to complete and return a confirmation form by fax to confirm they have received the information. B, gets notification via email or fax unless it is the first time the patients has been entered in the GP notified system. Option C, fax or emails the GP notify coordinator to confirm they have received the message. So what do you think is the correct answer for this question? Okay, so some of you have answered. Julian Manish, Linda Biju, Punni Cyril, Jinsi Alex Benny, Biji Aju have answered option A, and Nimsha Prasad, Prashant, Chinju Prasad, um, Biji Aju, Julian Manish, Litimol Chapko have answered option A. And Lebi Mary Thomas has opted B as answer. Grishma Vimal, Harsha Kurup, yes, Julian Manish, etc. Opted option A as answer. So we have a lot of answers coming up. Okay, so the correct answer for this question. Okay, this is a confusing question. I mean, the options are confusing. In that sense, okay, I think these are not the correct answers. Like majority, I think, have made a mistake. Hmm? Okay, you need to read it again. Okay, so I'll blame the options for you making a mistake because okay, the options are needs to complete because they are tricky. The options are tricky. Okay, so option A is needs to complete and return a confirmation form by fax. Okay, definitely the GPs need to complete and return a confirmation form by fax. That is correct. To confirm they have received the information. Okay, so they have not mentioned that they have to complete and return the confirmation form by fax in order to confirm that they have received the information. It is not for that purpose that they have to return this confirmation form. The purpose for returning the confirmation form by fax, of course, is for the automated notifications to continue. Okay, that is not for the purpose of informing them that they have received the information. That is not for that purpose, and because of which we are eliminating option A. Okay, so I'll just highlight that information. What have they mentioned? The form needs to be completed and faxed for the automated notifications to continue. Okay, so it's for that purpose and not to inform them that they have received the information or not. Okay, so and moving to option C. So we have eliminated A. So coming to option C, fax or emails the GP notify coordinator to confirm they have received the message. No, they have. They definitely they can inform the GP notify coordinator for, but for what purpose? If there is a contact detail change, because they have to make sure that the emails come through to them or the faxes come through to them. Okay, so for that purpose, if their contact information such as the email or phone number or whatever fax information or whatever changes, then they have to notify the GP notify coordinator. It is for that purpose and not to confirm that they have received the message. Okay, so if there is a contact detail change, only then notify the GP notify coordinator. Okay, not for anything else, and because of which we have eliminated option C also, because option C is containing that kind of information. Okay, which is not mentioned or incorrect. And moving to B. B is gets notification by email or fax unless it is the first time their patients have been entered into the GP notifies system. That is, the GPs will get notification via email or fax unless it is a very first time. In the very first time, the cases where it's a very first time, then they may not get the notification via email or fax, but they have it has been unless it's been entered into the GP notifies. Once it's been entered, definitely yes, they can give a confirmation message or they can complete the form, and then the automation notifications will continue. Okay, okay, so that is what is mentioned as per the extract, and because of which your correct answer would be. Okay, so the options were a little bit confusing, but I hope I have cleared the confusion because you can directly eliminate the other two options A and C and come directly to option Okay, so yes, so now we have completed the discussion of part B section of the reading subtest, and I hope you have understood whatever we have discussed, and the session was useful to you. And so we are winding up the session. So see you next week. Take care. Thank you.